Hi, I will discuss another graduation project, a graduation project that I supervised, I think 3 or 4 years ago. It's a project done by Roselle van den Berg, who was also interviewed for this MOOC. And her graduation project was in the domain of hip surgery, and the problem that she worked on was stated by one of the hip surgeons that we collaborate with. And he said, well, if I see hip patients in my consultation, most of them do fine after surgery during their rehabilitation. But I see two groups. One group is a bit hesitant to rehabilitate and they go too slow, and another group wants to go too fast. And I would like to know during my consultation how I could talk to them and how I could have my consultation in such a way that I can motivate them to do better during their rehabilitation. So we already made, in this bigger collaboration with these orthopedic surgeons, we already made a patient journey, this one. So it starts with prevention, having pain, going to the GP, going to the orthopedic surgeon, having surgery, and then having rehabilitation. And what Roselle did, she focused on the consult, and she made the patient journey of only the 12-minute consult. And here you see an example, or the example that she made. And of course, during the consult there are two parties, the patient and the orthopedic surgeon. She didn't include informal caregivers in her patient journey. But you see here, so the patient and the orthopedic surgeon, she also mapped the different emotions that they have during the whole consultation. And she also defined the different phases during a consultation. And what is nice about this journey, I think, so normally when you think about the patient journey, you think about months and the whole time it takes from having complaints until your recovery. And in this case, so you can also focus, when your design goal is already specified to a very specific topic, you can already also focus your patient journey on 10 minutes. What she did as well, it's not related to patient journeys, but it's nice to explain as well. What she did, she made, she defined 4 different patient profiles based on whether patients are actively involved in their treatment process or not, and based on whether patients are following what the doctor is saying, or if they have more intention to not follow what the doctor is saying. And based on that, we made 4 types. And what she saw in the experience journey is that an important thing is the expectations that patients have of their treatment. So what Roselle developed in the end is an application that works on a tablet. This is to give you an impression of the application. A nice other thing is that a small sidekick is that we make, each 3 years we make a booklet of all the graduation projects that are done at our faculty within the healthcare domain. So these are over 100 different projects within healthcare. Roselle is one of them. So she made an application, and it has 3 interfaces, you could say. It has an interface for the patient, it has an interface for the orthopedic surgeon, and it has a shared interface that is used during the consultation. The patient uses it to prepare him or herself for the consultation. What you can see here, I will show it to you in a minute. The orthopedic surgeon can look at his interface directly before the consultation to have an idea what type of patient it is and what the main questions are. And during the consultation there's a special interface where there's this interface where they can discuss together, patient and surgeon, what the options are and what they can expect and what you can expect in which time frame. So how she used the bigger patient journey and ook the smaller patient journey of the consultation is that she defined different touch points also in the bigger patient journey where currently information is missing to the patient, and she defined, well, you can use the application there to give extra information to the patient. So here you see the user scenario, and it clearly gives links to the patient journey, like complaints in daily life, that's before. Then they go to the general practitioner and make an appointment for the hospital. Consultation reminders, then there's the actual support during the consultation. Preparation of the patient for the consultation and preparation of the orthopedic. So those are two separate pathways. So then there's the consultation itself, and then you can look back at the information after the consultation. So the links with the journey are very clear. So Roselle, she defined, based on the bigger journey, she defined a problem, you could say, in the journey that was made during the consultation, that there's only little time and so many topics to discuss. And then she went back to the bigger journey to pinpoint where are touch points or where are moments in time where I can give more information to the patient and where I can give a little bit of information to the orthopedic surgeon so that the information exchange is more optimal. So in this I only want to show you, this is the screen that is used during the consultation itself, and it works with touchscreen and with drag and drop, that both physician and a patient can place what they expect and their activities on a timeline. Yeah, what is nice about this project is that it's used for a bigger funding proposal, and currently 2 PhDs are working on this project about patient profiling and patient journey mapping. One PhD with a design background and another PhD with a psychology background, and they work together to get more insights on this topic. Okay, thank you very much. I hope it gives you more insights.